not all of them are always experienced or expressed. So sexuality is influenced by the interaction of biological, psychological, social, economic, political, cultural, legal, historical, religious, and spiritual factors. All right, intimacy. What comes to your mind when you think of intimacy? What does it look like for you? So intimacy is separate from sexuality, can involve feelings of emotional closeness and connectedness with another person, and it's often characterized by attitudes of mutual trust, caring, and acceptance. A part of our sexuality, it might include intimacy, so that could be the ability to love, trust, and care for others, and both sexual and other types of relationships. And from an OT lens, intimate relationships involve executive functioning skills like planning and organizing skills, communication skills, emotional regulation, sensory regulation, self-awareness, and positive self-concept. So it can be expressed by a really wide variety of ways. Some ways might be holding hands, flirting, kissing, masturbating. It could be putting on lipstick or shaving your legs. So why do we care about this as allied health professionals? For one, sex is an activity of daily living, or an ADL. So it's in the same bracket as showering, toileting, dressing, and also a client's perceptions of successful performance in any area of occupation results in their overall quality of life and participation in life. So it's about providing holistic care and support. When we talk about sex, unfortunately, what happens when we look at people who've been injured or who have a disability, sexual needs often fall to the wayside. And all too often I'm hearing about people who were told, oh, you don't need to go to your sex ed class at school, or children with disabilities aren't provided the appropriate education. So it's really, really important that we, and we'll delve more into why, that we really begin to focus on this area, and it is definitely growing. So I wanted to quickly touch on some models of addressing sexual functioning. So in the 1970s, an American sexologist, J.A. Anon, designed the PLICIT model. So this stands for permission, so giving patients permission to raise sexual issues. Limited information, so giving patients limited information about sexual side effects or treatments. Specific suggestions, so making specific suggestions based on a full evaluation of presenting problems. And intensive therapy, so referral to intensive therapy, which could be psychological, sex therapy, or other specialists. The PLICIT model is really client focused, and it explores ways for clients to explore sexual matters and offer the limited information and make suggestions, and then referring them on when you reach the boundaries of your levels of competence. Unfortunately, with this model, what happened was lots of people believed it to just be a linear process, starting with permission giving once and then moving through the steps until the client is referred on elsewhere. So in 2006, Taylor and Davis reconceptualized the model, and they put the PLICIT element at the core of the model. So they put PLICIT in the middle, but at each stage, it gets the practitioner to reflect on how things are going, but also to review whether they need to change or adapt or move in different ways. So, and what we can see as well is permission giving is at the heart of each of the sections. So it's not just about asking for permission once, but revisiting this each and every time you talk about sexual health with your clients. With the Taylor and Davis adaptation of PLICIT, they put permission giving right at the core, so that when you're dealing with new or deeper issues with sexual health with your clients, you need to revisit it, because we might have permission to talk about it originally with them, but when we start getting to deeper things, we can't assume that we can just carry on. On this model as well, they haven't just put PLICIT into a different design, but they've also, on the outside, you can see they've focused on the work of the practitioner. So first of all, exploring self-awareness around what it is we're discussing with our clients. Do we have any personal biases? How do we feel about it? And then reflecting on our practice. And then that reflection can lead into our review so that we can be reviewing the session with the client as we're going along. So we can be considering if we should bring in different dimensions, or should we take a step back? Or does it mean that we need to find out more about ourselves and consider our own knowledge base? So it might be that the client is talking to us about certain treatments or aspects of life that we're not aware of. So that would be the time to refer on. And then finally, we need to challenge our assumptions. So whether that's in ourselves or in the services that we provide. So it really, it's a great model for holistic care. And I also really like it because it shows that you don't have to be one type of clinician to support clients with sexual health or intimacy. It can be really any clinician. So a big question that we get all the time is, how do I bring up sex or intimacy in a session? So first, initiate early. Second, we want to normalize it. So we want to open the door, allow people to talk about it. We know that most of the time, people aren't going to want to bring it up first. They're going to want their clinician to broach the subject. Of course, you'll have the odd patient or client that just says it out straight away and says, Izzy, I want to be able to do this in bed, please help me. But yeah, that's not as normal as people wanting us to bring it up first. And lastly, don't make assumptions. So we don't want to make assumptions as providers, like they're not ready to talk about it, or shouldn't they be focused on rehab? And yeah, if you wait until you're comfortable, we'll be waiting forever. So does anyone have any ideas or things that they use for how they might bring up sex or intimacy in a session? Feel free to pop them in the chat or shout them out. Yep, generalizing it. Yeah, absolutely. So some ideas might be just, first of all, finding out about the client. So are you in a relationship? Do you have a partner? Are you sexually active? In your opening spiel. So for example, I'll say the OT's role is to assist you to complete daily activities like showering, dressing, sex, etc. If in speech, for example, you might be able to say, some people on a modified diet say that this changes social outings as a couple. Are you worried this might affect your relationship or your social life? Or many people have questions about how affects their sexuality in relationships. If you have any questions, you can ask me. Or many people are concerned that their ability to be sexual and intimate with another person has changed because now they're a wheelchair user or they're using a walking aid. Or many women or men or anyone feel concerned that X has affected their sexual function, including arousal, could be erections, lubrication. Have these changes affected you? Some people say that having assistance with self-care, so like feeding or showering, changes the way that they see themselves as a partner or a wife or husband. It could be through providing parent education when you're dealing with kids or teenagers. There is an assessment which can help to guide questions as well, which we'll go into more later. It might be through observation. So I've said to parents before, oh, I noticed that your child often pulls their pants down in sessions or at kinder. Would you like me to begin working on public and private education knowledge with them? And you can always follow up with, is this something that you're interested in? if you'd like, we can talk about this, or would you like to talk about any of these changes? And yeah, and I can see Lucille, so open-ended questions. So we know sexuality and intimacy is a really important part of wellness and happiness. How is this looking in your life? Yeah, yeah. So just really kind of opening the door for the clients. A lot of the time they might not want to talk about it at the start, but because you've brought it up, they know that they can bring it up to you again if it is something they want to discuss. So next, I wanted to talk about the physical, cognitive, and emotional aspects of sex. This list isn't exhaustive, but so physical aspects of sex might be medication. So medication might make it more challenging to have an erection, or it could impact lubrication or libido. Pain, a lot of the time when people are in pain, they might not want to have sex or feel like they can't. Testosterone changes, it could be bowel and bladder use, so continence, genital function, fine or gross motor skills or limitations. Perhaps someone has loss of sensation. They could have decreased energy levels, so fatigue, or sexual dysfunction. So that's reduced lubrication, difficulty achieving orgasm, difficulty achieving or maintaining erections, and some caseloads where we might see these presentations. Again, there's many, but they might be like amputations, spinal cord injuries, knee replacements. Then the cognitive aspects of sex. So we might be looking at decreased safety awareness, poor judgment, limited self-control. If someone's hypersexual or hyposexual, difficulties with executive functioning, so difficulties with planning, memory, organizing a date, and communication, hyperactivity, impulsivity and inattention, and someone's sensory seeking or avoiding. So you could see this in presentations of ADHD, PTSD, pediatric clients, intellectual disabilities, list goes on, brain injuries. And then emotional aspects of sex might include things like self-esteem, body image, self-perception of success, valued roles, the partner's impact on the client, role transition or role confusion, and social skills and relationships. And I have just popped this image here, which it's from 2014, so it might be a little outdated, but it says that 1 in 4 people who report sexual assault are people with disabilities, and 9 in 10 women with intellectual disabilities have been sexually abused. So to me, this just really highlights the importance of us providing that education, providing that support to all different clients. So how can we provide support? As I said, I'm an OT, so if anyone is from any other clinical areas, please feel free to add into the chat. But briefly, speech therapy might be supporting clients with healthy and effective communication. So communicating needs, developing positive and safe relationships. I'm not sure if any of you have seen Love on the Spectrum, but if you haven't, I highly recommend it. It's a really great show that just shows that a lot of autistic people want to be in a relationship, but it also shows the difficulties and the challenges that come with navigating that as well. A speech pathologist might assist with changes in speech, how to continue to have intimate conversations with partners. If they might assist with communication regarding sex, so getting partners to talk about the assumptions that they're making and getting them to clarify their assumptions, or assisting them to communicate their boundaries. So if for example, if someone's engages in kink, they might need to be able to communicate where their cutoff is, or it might be talking with someone who is re-engaging in sex after a long time or after a sexual assault, and supporting them to determine where those boundaries are. That this can also be psych OT as well. Physiotherapy, so they might assist with continence, pelvic health, range of motion, pain management, painful sex, or men's health and penile rehabilitation. So some examples might be, a physio might even just assist with non-intercourse activities. So how do you go from prone to supine and then supine to prone? And maybe they're helping just to build strength and mobility and energy levels to be able to engage in sexual activity or to go out on a date. They could be assisting with painful sex, like conditions like vaginismus, dyspareunia, and other sexual health conditions, or in men's health. So following prostate removal, some surgeries might damage the nerves that cause erections, and physios can provide education on things like self-stimulation to prevent contractures. Psychology, some things that they might support with might be sexual anxiety, pornography use and addiction, sexual trauma, STI diagnoses, LGBTQI+ support, lowered self-confidence, new relationships, assertiveness, conflict management. And again, obviously there is crossover into other areas as well. And finally, occupational therapy. So we might provide support with positioning and safe positions, mobility aids, incontinence, advocating to engage with sex workers, sex toys or assistive tech, menstrual personal care, public and private education, mindfulness, pain, managing fatigue. So some examples might include with pain, that might be solved through positioning or mindfulness, or supporting clients to look into other medication with their other health professionals, or referring on to, say, physio, or it could be through assistive tech. And some examples, say with fatigue, might be supporting clients to coordinate around this. So when do they have the most energy? Planning, do they need to plan around a nap, or on days when the person has less to do? And it's all about supporting the client to get into a routine and establishing that goal-directed behavior. Or it could be providing education on energy efficient positions. So moving on, I wanted to talk about sex toys being assistive tech. So assistive technology is really equipment or devices that help you to do things that you can't do because of your disability. So any item, piece of equipment, software program that's used to maintain or improve the functional capabilities of people with disabilities, or not. So we'll go through some of these, but you might want sex toys just if you have limited hand function, or need something that's hands-free. Perhaps you have altered sensations, so following a stroke or an ABI, or you've got heightened sensation or decreased sensation. You might experience erectile dysfunction, and that could be possibly due to medication or conditions like MS or spinal cord injuries. You might have pain where you want positioning pillows or straps or harnesses, and we'll go more into those in a little as well. So looking into some of these, we've got up the top left, we've got a sit-on vibrator. It's hands-free. You can use it while you're in the chair. We've got ramps and wedges, which can help to promote positions or reduce pain. We've got strap-ons, so you can pop dildos in there and still engage in intimate behavior or sex as well. And sex doesn't have to mean penis in vagina. So sex can mean many different things to different people. We've got the intimate rider on the middle left, and this is designed for people with C6 to 7 tetraplegia. So this piece of AT facilitates a natural thrusting movement, and you need minimal upper body movement as well. We've got straps, which can help as well if you have any spasticity. We've got on the middle right a vibrator which sits in the underwear. It's hands-free, can be remote controlled via an app as well, which makes it more accessible. The bottom left, you've got a vibrator that can go on a penis, whether it's flaccid or erect. We've got dilators to help with painful sex, and then massage oil. So something as simple as promoting massage through partners can help with pain. And then not on here, but there's also different toys that promote sensory stimulation. So whether to meet different sensory needs. And sometimes clients just want vibrators to enhance the experience. And if a client doesn't have the products or can't get their hands on them, they can also try household products that might come in handy. So even things like a shower chair and being in the water. So a shower chair, I like to say, it's not very sexy unless you're having sex on it. And also being in water as well can assist with changing the sensations and the feelings. So going a bit deeper into positioning, we've got some lovely images here. Most of them are from our website and our designers. So we've got things like on the middle left, a sex sling. So this it can promote movement, or you can hold legs in place, and can, because sometimes when you don't have something holding you in place, that might promote spasms. We've got a few images here with different chairs and how you can use your chair to your advantage. So we could be promoting sex in a chair. Why not use the benefits of a power chair and use that tilt and recline feature? Obviously, just remember that to comply with the weight limits of the chair and any safety precautions around that. And then, wedges and ramps, you can see in a picture on the bottom left. These are all there to take the load off, to reduce stress on backs or on various joints as well. So some common questions that we hear regarding AT is, first is, how will I know if they'll want to use sex toys, or how will I know if they'll be offended if I talk about sex toys? So there's lots of things that we often recommend to clients or participants, and they say, no, I'm not interested in that, or that wouldn't work for me, I've already tried that. And that's okay. So it's all about not making assumptions about the people and then not offering support because of that assumption. Again, we won't know until we ask. Second is, when is it an appropriate time to ask about sex toys? Have they expressed interest in it? Have they expressed a goal related to pleasure or sexual activity? And thirdly, how do I ask? So it could be something like, are you comfortable, or have you ever considered using a toy? Have you used toys in the past? Or have a look at this. This is something that could help. What do you think? So I wanted to go into a few great resources for therapy. The first is SECA. So SECA, which stands for Sexuality, Education, Counselling and Consulting Agency, is a non-profit organisation designed to support people with disabilities in their efforts to learn about human relationships, sexuality and sexual health. They also have a fantastic app on their website, and it's free, and it's got really good lessons for all professions. So I've popped in a screenshot from there. You can see they've got lessons on puberty, menstruation, masturbation, sexual intercourse, relationships, and there's more to that as well. And here is some examples of that. So there's one example here of sorting public and private places, and another example of a lesson plan for how to teach about disposing of pads properly. Another resource that's really great is Touching Base. They're an organisation that assists people with disabilities and sex workers to connect with each other. They're full of knowledge and always there to help. And then there's the OPC, which is the Occupational Performance Inventory of Sexuality and Intimacy. And what it is, they've got a self-assessment and initial screen. It's a great way to start the conversation or to find out more if a client expresses a goal relating to sex or intimacy or relationships. And finally, XES Products. So it's an online store that sells sex toys and accessories with accessible features, and it has resources and blogs relating to disability and sex. I could see that Chloe Bright's in the call today, and she's actually written a brilliant blog for us as well that's up on the website. So on all of the products that we've got, we highlight the accessible features on those products, because we find that that's a really big barrier just to begin with, is knowing what might be appropriate for the client or for the user. And then our blogs are written by people with lived experience. They're written by health professionals and a really wide range of people. So therefore everyone, disabled or not, and health clinicians, families, you name it. And it's really there just to make sex fun as well, not to make it like this icky or sterile environment. And we can also sell products through the NDIS for plan managed and self-managed clients. So thank you. Yeah. Does anyone have any questions?
Thanks so much, Izzy. I'll just turn my camera on. That was fabulous. No questions jotted down, so feel free, anybody, to drop those in the chat or the Q&A function now, or request the microphone. I'm not sure if we're able to do that in this setting. Give everybody a couple of seconds. While folks are thinking about that, Izzy, could I ask a question?
Yeah, absolutely.
First of all, sorry for mispronouncing XES Products
No,
earlier. What was your pathway to your interest in sexuality? Thinking about pleasure and inclusivity. Were you an OT first, and did you see a need in that space, or did you sort of come to that your allied health role with the intention of building support people's pleasure and sexual well-being into that?
Yeah, well, it was always an area that I was quite interested in from back in university. And I was told when I was at a rehab hospital, I asked, why aren't we asking about sex? And I had an older supervisor, and I was told, oh, that's not something that we talk about. And that kind of started my gears of frustration. And I didn't have much education about it as well throughout my university process, and it's just so OT. It's an activity of daily living. It's something we do in our everyday life for most people, and I think it needs to be spoken about. I personally thought if I ended up being having a disability soon, or most people do, 1 in 5 Australians have a disability at some point in their life, I would want my healthcare professionals to broach the conversation with me and to support me in that. So that's what started the gears. And then I started having lots of conversations with different people with different types of disabilities and health conditions. And they basically said, yes, this is what we want. This is what we need. When we're looking, a lot of disability stores look quite old and not so inviting. So we wanted to make it a fun and inviting store. So that's how XES started. And
Great.
I should also mention, we're also currently developing our own accessible product, so that we're hoping that will be out soon.
Looking forward to it. Another question from Dawa, an important one. Is masturbation bad for health?
No, definitely not. So masturbation can help with all of those feel-good hormones. It has actually been shown orgasms can help reduce pain as well. Obviously, orgasm doesn't have to be the end goal, but yes, no, definitely not bad for health. Definitely recommend if that's what a client wants to do.
Fabulous. Lucille asks, do you see in your work less stigma with the younger generation? In Lucille's work as a sex ed professional, it's changed and it's more mainstream. How do you see the future of sex and stigma?
Oh, it's definitely getting bigger and better, and there's definitely less stigma the more we go. But there's definitely less stigma with the younger generation. But I'm also hyper aware that I am in a bit of a sex bubble with all of the clinicians that I work with and the people that I work with. So yeah, I think, yeah, there's definitely less stigma, but there's still a long way to go.
Okay, great. We have an anonymous question. Is it normal to be nervous while having sex with another person?
Absolutely. Absolutely. I'm sure for anyone, if you think back to your first time, second time, third time, whatever time, new people, that can be nervous, or trying new experiences, or if you don't know what you can do or what you can't do. So taking that back to disability, it's also just making sure that that person feels supported to either communicate their concerns, or to know what they can try, what's safe, what's not. Yeah.
I would say not just fourth, fifth time, hundredth, thousandth
Yeah.
time. I don't think it ever really goes away, and
Yeah.
sort of it shouldn't, because it's such an important thing.
Yeah.
It's okay for that to be an element of nervousness there, for sure. I would totally agree. One more anonymous question, an interesting one. It might be a little bit beyond your scope, but I'm curious to see if you can speak to it. What causes erectile dysfunction? Is it all psychological?
Yeah. So definitely not all psychological. It could be because of medication. It could be due to different conditions. So conditions like MS, Parkinson's, individuals with spinal cord injuries, lots and lots of different things, prostate cancer. I'm sure there's lots more, but probably more medically oriented to answer that.
Okay, great. So we've got time for one more, and we might sort of move away from the themes we've been talking about. Could you tell us a little bit about your more about your business journey? You've spoken a little bit about it, but is there anything else you can add to us there?
Yeah, I think the most exciting thing that we've seen is the positive impact that we've had for people to, I guess, like being able to read the blogs and providing that education. That's just, that's just been very, very exciting for us. It's been, I think at the start when we started creating our product, we wanted to create something that was accessible for everyone. And that's obviously not possible. So we've kind of had to take a step back and start talking with lots of people about what they want. And then hopefully with our range, when that happens, we'll be able to have different products that are accessible for everyone. So we'd love to hear from anyone in this who's watching this. Please get in contact with us. We're always keen to hear about other people's experiences, whether that's from yourself or whether that's about what you've worked on with clients, because that's what our company is based on, where that we can't have all the information. We learn from our conversations that we have with others.
Fabulous. Well, unless we have any other last questions coming through, I think we can all please give a little digital round of applause and thanks to Izzy.
Thank you.
Thank you so much for joining us. Is it okay if we forward any other questions if folks email them to us afterwards through?
Absolutely.
Great. Well, thanks so much, everybody. And thanks for joining us. Have a lovely Friday. Thanks again, Izzy, for presenting. Hope everybody has a great weekend.
You too.
Cheers. Bye, everyone.
See ya.